And I see all this red bleeding that I'm having, and I'm kind of weirded out by it. What are you gonna tell me about all this vaginal bleeding?
That's normal. You're gonna have this
It's
bright
normal to
red.
have some bright
Some
red.
But she just had a baby.
I know.
Okay.
You don't want like an excessive
Whoa.
amount.
Okay.
So will it stop like tomorrow?
No. For the first 1 to 3 days, you're actually gonna have this red bleeding, and then for some days after that, it's gonna get lighter
Until the 11th day.
until about 2 weeks
It'll be like a
after.
pinkish color.
Now, if you get your 2 weeks out and you start bleeding red, you probably call the doctor.
Probably just come in.
Yeah.
Okay.
Yeah.
So tampons, I can put a tampon in then during this time.
No.
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 Go in for 6 weeks.
Yeah, I don't think you're supposed to put anything
Yeah,
up
yeah.
there.
No, you're not supposed to have sex or put a tampon in for 6 weeks. Don't put anything up there for 6 weeks.
Nothing in my vagina for 6 weeks.
Mm-mm.
Okay. How much can I lift? Can I go home and help my daughter tear down a wall?
Nope.
Just the baby.
Just the baby?
For, is it at least like 3 weeks maybe? Or is it 6? I don't know either. Maybe I just made that up in my head. I don't know.
Yeah. I don't know where you got that.
When I get home though, because I'm just laying around here all the time, when I get home, is my bleeding gonna like really keep getting lighter and lighter?
It's gonna go back to being heavy for a little bit, heavier for a little bit because you're moving around.
You're moving around more than you are here.
So the weirdest thing happens. After I've been laying here all night, I get up in the morning and it just, that can't be right.
That happens to me once a month actually.
It just all pulled up overnight. So then when you
It's
stood up,
gravity.
Oh, it's pulling up in there.
Yeah.
Mhm.
Okay, these stretch marks, oh my God, they're gonna go away, right?
They aren't gonna go
Fade.
away,
They fade.
but they're gonna turn like a
Like a silver,
silvery
yeah.
color.
They're not gonna go away?
No.
You can tattoo over them.
It's a sign you had a baby.
Oh, I don't know if I'm gonna have a baby. Okay, so these stretch marks aren't gonna, there's nothing I can put on, oh, vitamin E, right? That'll make them go away.
They will never go
It will
away.
not go away, but it could
They-
help lighten it.
Yeah.
Yes.
Put scar cream on them.
All right. What about this line I've got, this really, really dark line? That is really hideous. On top of the stretch marks, I got, what is this?
They'll go away.
Yeah.
Niagara. Niagara's the falls.
Niagara. I don't know.
So
it's
this
okay.
is gonna go away? What's causing it right now?
Melanin?
That's a good question. I know what it is.
I don't know, I feel like I have it too. Well, so this will go away. This is hormones, and melanoma, it's just lots of things causing this right now. It'll go away.
Oh, it does go away? The line, the pregnancy line?
Millennia
Oh.
Negro.
Oh, I didn't know it goes away. I thought it, we kind of do, we all do have a really small one though, right? Like on our,
Dark skinned people probably do. I don't.
Yeah, I don't.
But it very, very, yeah,
Mhm.
yeah, I do actually see a lot of dark skinned people with a little bit of a line. Yeah. Okay.
when
So,
does it usually go away? Sorry.
when does it?
Like
No,
how
when
long?
does it?
I don't know.
Oh.
Probably by the time you can see all this under here.
So that's not gonna be a test question.
The amount of time isn't gonna be enough.
Okay. Cool.
Hey, so you guys keep asking me if you can give me these shots. What are these shots you keep asking me if I want?
One of them.
Why?
Excuse you.
One of them is your MMR vaccine that we give to you in the hospital after you have the baby, because I know that you're not pregnant, because you can't get it when you're pregnant.
Why not? Which one of them can't I get? What is MMR?
You
Measles, mumps, rubella.
Okay.
You can't get the measles part.
No, rubella. Right.
Is it rubella?
Rubella.
I was just joking, y'all.
But after you have the baby, we're gonna give it to you if with your consent, because we know for a fact, 100%, you're not pregnant.
Okay. What is your follow-up teaching on that?
Don't get pregnant for a month after.
Oh yeah.
I think it's 6 weeks.
6 weeks?
Something like
6 weeks?
Yeah.
I mean, you're not
There's a
supposed to
time
put
frame.
anything up there for 6 weeks.
6 months, saw that another time frame. Don't get pregnant
People
right
be
away.
wild.
It is 28 days or something. I don't know.
People do wild things.
You can say-
Bro, my mom and dad got pregnant very fast.
One of my
4
friends,
times.
her and her brother are 10 months apart. I said no.
Yeah.
Immediately no.
Yeah.
That's waiting 30 days?
Yeah.
No.
What are the risk factors of that? Why don't I wanna have sex right away?
Because of vaginal tearing.
Okay,
And it could cause hemorrhage.
infection,
Infection.
we need to heal.
A lot of trauma just happened.
There was a lot of trauma that just happened. Let me see, what other teaching might we need to do? This weird skin coloring on my face, what's that all about?
What is that?
Plasma.
Yes.
Colasm?
You better remember that one.
Colasm.
What is it?
Like
Hyperpigmentation.
Hyperpigmentation,
Yeah.
the mask of pregnancy.
It's normal though.
It will go away.
It will?
Mm-hmm.
Oh, thank God. Okay. So, tell me some of the things. I had a vaginal delivery. You're discharging me. What are some things you would want me to call my doctor about?
If your bleeding does like go backwards, like if it's like lighter bleeding and then all of a sudden it gets really heavy, or if it goes from like a lighter color to a darker color.
Anybody else?
Sharp abdominal pains at all.
I get those though when I'm breastfeeding the kid.
Oh, that's just the uterus contracting, but like just. Well, I mean, that helps it shrink back to normal, but I
Okay.
mean, really bad, any kind of really bad pain in there.
But you don't wanna go back in for that. That's just your uterus contracting.
So how am I gonna know the difference? When I sit down and I breastfeed, I have those really bad pains, but that's not what you're talking about.
No, I mean, that's it's not, I'm not talking about like contraction, I'm just talking about like, I'm thinking in my mind like any kind of hemorrhage or something. I know it's a vaginal delivery, but.
But what are you gonna tell your patient? I don't know what you're talking about.
Oh, never mind, let's talk to the other nurse.
I quit.
I'm just trying to participate.
No, you're not wrong. Some sharp pains. We need to help them differentiate that from those contractions, because they're not gonna know. So we gotta help them differentiate
If
that.
they're not happening when you aren't breastfeeding, it's most likely the contractions, and if it's happening at other times, could indicate something else is going on, so you might wanna come on in.
And you know, you're saying that you're having this pain while you're breastfeeding while you're here. So you know what the breastfeeding contractions feel like. So if you're having these other odd sharp pains that aren't like that, say now, oh, okay. What else? Why else would I call my doctor?
The baby gets a temperature,
I'm not talking about baby
or
yet.
we're focused on mom?
Mom.
If mom gets a temperature,
If mom gets a temperature,
or she's got some weird vaginal discharge.
what do you mean by weird?
I knew that's coming. If it has like any pus in it, or if it's green, if it smells
Smelly.
really bad.
What will it smell like? Now, if this is one time you can tell your patients, you'll probably know. It's gonna smell bad.
I'm sure they could probably smell it too. I said I'm sure they could probably smell it too.
Yeah, they'll know.
You'll know.
Okay, anything else? Any other reasons I told my doc once I got home?
If after like a couple weeks of really, really persistent depressive symptoms, like you just feel you can't do it, don't wanna look at the baby, if you ever have thoughts about throwing the baby, call the doctor.
Oh, come on, everyone has that thought every now and then, right?
If it's a consistent thought.
You're making plans.
Okay, so we talked about fever, sharp pains.
If you haven't had a bowel
discharge.
movement in a couple of days, you might wanna
Okay,
talk to your doctor.
all right. Now you're sending me home on stool softeners, so what's the other side of that? If I don't have a bowel movement, or
Diarrhea.
if I'm having diarrhea, cut back on my stool softeners and watch my fluid intake. Okay? Oh, how much fluid should I be taking in if I'm breastfeeding?
3,000? 4,000?
You act like you just made that up.
No, that
No.
was like
1,500.
no, that's low. If they're breastfeeding, they need more fluid. That's why I doubled
You
it.
don't know either.
That's why I doubled it and went with 3,000. But then I thought it was kind of low, so I went
Okay,
with
who's
4.
right? Who's closer?
Who has the resources?
None
I don't have my book. I definitely forgot that.
You're supposed to have 2,000 a day, like if you're not breastfeeding.
And you don't have to double it.
So is it just 2,000?
It's more than 2,000. It's
Oh.
like, yeah, but not 4,000.
Closer to me though.
Yeah, well, shut your mouth.
Shut your mouth. My nurse last night said that my white blood count was elevated. Does that mean I'm sick?
No, it's actually normal when you just give birth.
How high can it get?
What?
How high can it get?
20,000?
No,
25,000.
25.
25,000.
What about breast symptoms to call the doctor about?
You get like a red hard spot.
A lesion.
It feels hot.
Did you say it like that?
What?
You said a lesion.
I don't know. I didn't mean to.
If you got like any pus or anything coming out of there.
Okay.
Ew.
25,000 is actually okay for a white blood count postpartum.
So it's above 25,000.
Yes.
Look at how much hair I just lost.
Thank you.
So if I have this red lump in my breast while I'm breastfeeding, can I keep breastfeeding or I should stop, right?
That's messed up. You can keep breastfeeding.
I can?
It doesn't hurt my baby.
So the baby's gonna be sucking infection into it?
Maybe don't feed the baby. Well,
No, you
no,
can.
because it doesn't get into the milk ducts.
That's right, it's in the tissue.
Yes.
Yep, so please keep breastfeeding and pumping and keep that clear now. Call the doctor, you get really, really sick really fast with mastitis. Okay. What if, you know these little blisters I've had in my nipples, sometimes they bleed a little bit. I should
Ow.
stop breastfeeding?
Yeah.
No.
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 So that's normal.
Meh.
What?
it's not like super
It's on your
uncommon.
nipples. You want your baby to be slurping
what
on
if
your
Get
blood?
a nipple shield.
You want your baby to be slurping on your
Yeah, that
blood?
was like
Because
somewhere
I'll let
there.
you tell. I'm gonna tell you something right now. I'm not sucking on no nipples if there's blood. I'm just like, you know.
Think about the small amount of blood that would be there, and that ain't gonna hurt the baby at all.
That baby was literally just in that womb for 9 months,
Mhm.
Oh god. So if there's blood, they can.
Matter of fact, sometimes the milk itself, they call it rusty pipes, has a little bit of redness in it, or darkness. That's okay, rusty pipes are okay. So tell me about my body now after I've delivered. Am I gonna look like my former 20-year-old non-pregnant self?
Not a chance. You're done. You're done.
We need to talk about communication time.
Okay.
I'm done.
Tell me your frustrations about this.
Tell me more.
No, you're
Please tell
educating
me
her
more.
right now.
No, she said I need to work on my communication.
Yeah, but she said, "Is my body gonna return
Oh,
to this?"
okay. You're right. You're right.
Is there a specific
Tell me more.
concern about your body?
There you go. Is there a specific concern?
Mm-hmm.
But odds are you're not gonna lose the weight right away. You should not do like intense exercising right away. It could cause a hemorrhage, cause a lot of bleeding.
But I can go on a really tight diet.
No.
No.
You need to take in more calories
You
because
need
you're
to-
breastfeeding.
Yeah.
This sucks.
Does that breastfeeding like actually help you lose weight? Yeah. Breastfeeding actually helps you lose weight.
Oh, okay.
Incentive.
What about,
Spirometer.
because my husband is really, really worried about sex. He thinks that it's just gonna be just like a wet washcloth. Is that true?
That's disgusting.
Right, that I said it before a patient said it.
Oh my god, I would have lost it.
What does that even mean? A wet washcloth?
Just loose.
I've heard about like a hot dog down the hallway.
Because it's so spread out and the hot dog just flings down. Wet washcloth, that
They're gonna
used to
watch
be
that
like
recording and be
gritty.
like, what the heck?
Oh, I forgot. I forgot
I forgot what.
We've been
that she's recording.
Yeah.
Oh.
So it's fine. It's just for like Bailey and like them who can't be here.
So vaginally, cervically, what's gonna happen to me now?
It will tighten more than it is like right now, like after having the baby, but it won't go back to as tight as it was ever.
My vagina or my cervix?
Cervix.
Vagina.
Cervix is never gonna have that nice tight round again. It's always gonna have a slit in it. There's some exercises I can do for my
Kegels.
Kegels. Teach me about Kegels. What does that mean?
If you want to know if they feel like it's like you pee and then you stop, and the muscles that you use to stop peeing are the
That's a
kegels.
good. That's
Yeah,
a good
'cause I was
explanation.
about
I was like, I don't know how to
I definitely started doing them to like try to explain them.
Yeah.
We're all sitting here doing our Kegels right
Yeah,
now.
Y'all stop. And
So that's actually a good way to teach them. Have them go in the bathroom, start to pee, and stop. Start to pee and stop. Now they don't want to keep doing that because now we're looking at a risk for infection. But that's a good way to teach them that muscle. They need to do it, even if they never intend to have sex again in their life. What's another reason they need to do the Kegels?
Stress and
pelvic
continence.
floor muscles.
Stress incontinence. If you're not doing your Kegels, guess what you're going to be doing when you're 50 and 60?
Peeing.
Peeing your pants.
That's like Jessica was. She's at the gym doing jump rope, and she's like, I need to start doing Kegels. I'm like, girl.
My oldest sister, who's granted quite a bit older, can't jump on the trampoline anymore.
Dude, when I laugh too hard, I definitely pee myself.
Kegels. Do your Kegels.
I do.
Do them.
Just
Now.
I'm too
Right now.
I
Let's
am
watch.
too-
Show us.
How do you?
Whoa.
The best part about them is you can do them and no one will even know you're doing them.
Do them while you're having sex.
That's a lot of concentration.
Is that supposed to enhance sexual experience?
Well, it seems like it would tighten things up, wouldn't it?
I don't know.
I think you kind of, okay, this sex ed, I think when you orgasm, you do kind of do Kegels. Not purposely, but, I mean, you think about the, right?
Also glad Robert's not here.
He'd be fine. He can be very animal.
Leading tips.
Why do y'all keep coming in here and pushing on my stomach? Knock it off.
Do you want a hemorrhage? I don't think so.
What happened to patient communication?
Oh, sorry.
That's
Sorry.
tip.
Well,
I'm gonna give you my husband's phone number. You're gonna have a talk with him about some of the bullshit he does. Okay. Why do you keep pushing on my stomach?
To make sure that your uterus is firm and like it's still contracting, so that it'll shrink back down and not like cause it to bleed. And we also want to know where it's at, 'cause it needs to move back down into place.
So the primary thing is the bleed.
Yes.
Okay. All right. So can I do that myself?
Yeah.
It's very helpful if they do it themselves, then you don't have to push on them so hard.
Hmm.
So if they can massage.
I feel like I would rather have someone else do it. Because, like, giving pain to myself, I
But
would
see, that's the
like.
thing, you don't really have to if you're doing it to yourself.
Do you just kind of like press your tummy then,
Just kind of
or do you like?
massage.
Oh,
It's a
okay.
big stress
Massage.
ball.
And then when I come in as a nurse, it's already firm, so I can just go, oh, nice,
Mm-hmm.
instead of jamming on you. Okay?
So why don't we do that? Why don't we like go in there like massage their stomach for a second and then like press? Or are we gonna be so aggressive about it?
Because we needed to tighten up.
Yeah, but why can't we just walk in, do a little belly massage, and then feel it?
We could.
We just don't.
I mean, but how long have I been flaccid, I guess, would be part of the question. You gotta tighten that thing up fast. Let's see, what else should we reveal? You were talking about, speaking of, before I look at some more questions, we were talking about pushing on my uterus, and you were saying measuring it. Tell me more about what my measurements should be.
About for your fundus?
Yeah.
Is that what you're talking about?
My
Okay,
height.
so right after you have a baby, your fundal height will be about right at your belly button.
Okay.
And then as time goes on, it's going to get lower and lower and
Isn't
lower.
it? I think it's like a finger width every
It's like
day.
it's like a centimeter
Yeah.
or something.
And so then by 2 weeks, it'll be down back in the bulb.
And you won't be able to palpate anymore.
See, that was a much better answer, thank you.
I'm trying to be nicer to my patients.
Mm-hmm.
I'm
Who-
so nice, guys.
So I keep having these contractions we talk about while I'm breastfeeding. Tell me what kind of women are gonna be a risk for the worst, like after pains?
People who have had multiple babies.
Okay.
The uterus has to work harder because it's been stretched out and stretched out.
Did I
and
make up
stretched
the
out.
number 5? Or why is 5 in my head for that?
Because if there's a patient who's had 1 baby or 3 babies or 5, the 5's
You
gonna
may have
hurt.
heard your teacher mention the number 5.
When you have 5 or more pregnancies, you are a grand multip. Not just a
Okay.
multip, but a grand
Okay.
multip. There are 2 of us in here who are grand multips.
Oh,
You're
I'm
in high risk.
All right.
Congratulations.
Thank you.
It's not as cracked as to be. Let's see. I'm gonna move, so this is one of those again where it's a pool of questions. And you get random questions out of the pool.
On ATI?
She said she created some and ATI created.
Is that on Blackboard? Okay, I have a special request.
Mhm.
Just to be fun. Okay. So what if you, when you like did them on Blackboard, what if you did them all on like one page?
She did that for the last test.
See, I can never keep up who does what.
She did it for the last test.
Yeah, that was cool. That was
So you
cool.
can just ask before the test starts,
Mhm.
and we'll tell you. And if we don't remember, we can look it up.
But do you know what I'm
No,
saying?
but like a lot of our teachers, like once you do that question, you're done. You can't go back.
I just like that,
Like that
having
test
them
we just
all on
did.
the same page
So you
rather
see them
than.
all at one time.
Yes, that's what I like.
Mhm.
Okay.
I do that knowing that, like, adult health probably doesn't do that,
No.
so.
I like it. It like I feel like it like reduces my stress. It makes me feel like it's less of a test. I
I've
don't
been
know.
on the
That's
P's
me.
ATI. I thought we could flag it and go back.
You
And so
could
I was
for,
just
like pre-test, but
Oh,
not.
shit.
No, I was just like, click, 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 click. There's no flags.
Yeah.
It's like, well, those are probably wrong.
All right, let's see. Oh, there is a little bit of math. For example, an insulin pump. Talk to me about RH incompatibility.
Okay. So you, let's say you're a mom. Well, you are a mom. Okay. And you give birth to a baby. You have a negative blood type.
I have a negative blood type.
Mm-hmm.
Okay.
Then you give birth and your baby has a positive.
Okay.
Mhm.
Okay. You are going to be taking what's called okay, I get Rogaine because there's Rogaine for your hair, and I sometimes like say the wrong thing.
Rogan.
You're going to be taking
Rogan.
Rogaine to prevent your blood from attacking your
Future
baby, your future babies. Yeah.
A future baby.
Future, that's key.
Positive blood
Yes.
Okay.
I did not explain that well, but I know what it is in my head.
And so every pregnancy, am I gonna have to do this?
type. No.
Oh, I'm not gonna
No.
do this for every pregnancy.
Yes.
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 Because every baby is a whole new chance of being positive.
That's what I said.
Yeah, I know. Tell me about this stupid nurse yesterday. She came in and she pushed on my stomach and she kept pushing over in this area and made me get up and go pee. And then she pushed all over again. What was that all about?
Because your bladder was full.
I did have to pee.
Mm-hmm.
Your
So-
uterus was off to the side because your bladder was so full, and so we wanted to make sure that when your bladder was empty, that your uterus went back to the middle.
Well, why? It wasn't bothering me that my bladder was full. Why did it bother her?
Just to make sure that the bladder could go back to the middle so it can go right back down into the pelvic cavity.
So you're just worried about my uterus going back to where it was?
Doesn't hemorrhaging have something to do with
It
this?
has a lot to
Oh,
do.
yeah.
Okay.
Dummy.
Just kidding.
Yes, if my bladder is distended, I'm holding the uterus in such a position that it can't clamp off that.
So first you have him pee, then if it doesn't go back midline, then it's probably him.
Right, now I'm worried
But
about
if it does go back, then he's
It's
probably
probably
at full
just- yeah.
time.
Okay.
I was right.
Not really.
What are some things, we've done a lot with vaginal, a little bit about C-section. So C-section is a surgery.
Mm-hmm.
So what are some things that are gonna make the C-section postpartum different than the vaginal postpartum?
Incentive
In-
spinometer,
Incision. Checking their incision.
incision care. You can bleed a little more with a C-section and it not be concerning.
During the C-section, yeah,
But,
but not afterwards. It's usually gonna be about afterwards. What
You're
else?
gonna need help. You go home, you're gonna need help.
Okay, all right.
I mean, because it's like it's abdominal surgery. It's not just like the healing. I mean, you need help anyway. You should have help. But I've had friends who've recovered. My daughter recovered from a C-section. It's just like so much more painful.
You like
Just,
really can't lift much weight.
like just moving.
Yes.
Just
Well,
all
yeah.
this-
Yeah.
So a number of years ago, it was vogue to have a C-section instead of vaginal delivery, because that's what all the Hollywood stars were doing. But that it's being a nurse in that field, we're like, that is a whole lot worse to have to recover from. So just think surgical, any surgery. What are some other considerations we have to think about?
Post-op infection.
Infection,
Get you up and moving.
get you up and moving, because
Get blood clots.
DVTs, high risk of DVTs postpartum, right? Because of all that platelet and all that stuff going on. You guys learned about that, I think, with Lindsay. DIC or HELP? Not ringing a bell at all.
DIC sounds familiar, but I couldn't
See, I think the help sounds familiar because is it 2 L's?
Mm-hmm.
Yeah, I remember she wrote it on the board, but I don't remember what it was.
I remember
Okay.
going to DIC, but I don't remember.
Is DIC the thing where they bleed out their eyes? No, never mind.
Girl, what? I have a wedgie,
I don't
sorry.
take care of DIC or HELP because they are of DIC, which hint, hint, nudge, nudge. So just refresh your memory on DIC and on HELP, okay? They're kind of related to each other. And they are,
disseminated intravascular coagulation. Condition affecting the blood's ability to clot and stop bleeding.
Yeah, so that is where they bleed out their ears and their eyes and everything.
Abnormal clumps of thickened blood clots form inside vessels. These abnormal clots use up the blood's clotting factors, which can lead to massive bleeding in other places.
so it is literally the body fighting itself. I'm hypercoagulating, taking away all my resources from everywhere else. Hey, how's it going? Whoa, you're on speaker with my class, so just be careful.
It was great, like you said, Darcy, fabulous, very rewarding,
Just careful.
it's never stressful, never frustrating, no, it's great.
Yes, okay, well, my teacher has a joke for you.
Oh, good, I like jokes.
Can you hear me okay?
Probably not, no, she's deaf.
So I understand you are an OR nurse,
Correct.
so you do know the difference between a surgeon and a vulture?
I bet I'm about to find out.
A vulture at least circles 3 times before it bites you in the ass. That's all.
I love it.
You can tell
I'm gonna
Jenna.
come out with a morning huddle on Monday.
Yeah. Okay. Yeah, well,
Okay, we talked about incentives.
I'll call you later. We're doing a test review.
We
Love
talked
you.
about
Bye.
blood clotting.
Is it bad that I didn't get the joke?
Surgeons are just notorious for being
Oh,
assholes.
assholes.
Oh.
So at least a vulture.
They have
circles
a
3
god
times.
complex.
Yeah.
Big time.
Okay, yeah, I didn't get it. I was trying to
Yeah.
figure it out.
Yeah, they're just rude and abusive. They're abusive. That's the
They like
stereotype.
they've like thrown things like across the OR, and then it was actually like them who like messed up.
Uh-huh.
So
Cute.
yeah, and they don't apologize either. So.
I mean, that's stereotyping, of course, and we've come a long way in that field.
She does
The-
have a really great.
The surgeon that I followed, he was actually really nice.
Mhm.
Mark Isaacson.
Mhm.
Don't know if y'all had him when you had surgery.
The ball one.
No, he's like really tall, but he was like telling the nurses, he's like, "Good job, you guys did great," and I was like, "Oh, he was really nice."
There are some very nice surgeons.
Okay, sorry, we can continue.
Indications of postpartum infection?
Abnormal discharge. Again, the funny colors or the smell. Fever. Cold sweats. Anyone else?
Get the hell off your sock, you're disgusting.
She has it on a coaster.
Hmm?
You have it on a coaster.
She has hair on her socks.
Oh, hair in her socks.
She's gross. Put this one on
I
coaster,
literally
please.
just took a whole clump of hair off of your sweatshirt. Like a clump.
I have lupus.
She does not. She's a liar.
You're a little light skin for that, but.
Oh,
Mastitis, we talked about mastitis earlier. What are some risk factors for me developing that? Risk factors that I might develop mastitis.
Well, if you're not breastfeeding.
Not at all.
Yeah, like if you're gonna bottle feed and you want that milk to go away, it might, might plug up and get infected.
Okay,
You put cabbage leaves on it.
what else?
Are you more at risk if you're AMA?
I don't think so.
No.
I don't think so.
I don't know.
Okay, but I am breastfeeding.
Oh,
So what puts me at risk?
Smoking.
Well, not necessarily in this case, that's not specific to this, but smoking puts you at risk for everything, yeah.
Not emptying fully, maybe?
If you don't empty fully, yeah, that can clog up in there and become infected. So who doesn't empty fully? Think about when a mom is breastfeeding
And bottle feeding.
and
Well,
bottle feeding.
Or like if they're, premature or a newborn, they're not drinking very much, so
So maybe they can't empty it.
maybe, yeah. It's not good.
So not emptying the breast, part of that often is supplementing with a bottle. Can you think of anything else? I mentioned something. Blood, something with blood in my nipples. Blisters on my nipples, because one, it hurts, and two, it might be covering a duct. So if your mom has blisters on her nipples, that's why we're assessing, one of the reasons we're assessing so closely. Okay? Here I'm looking at signs of thrombophlebitis. Again, I'm looking at ways to prevent DVTs. I'm looking for what I will do if I suspect a DVT. I'm looking at what makes me suspect a DVT. Okay. What is the scary thing about the DVT?
Can make you croak.
Tell me more about that.
If the blood clot like breaks off and goes to your heart or your lungs or your brain, can cause like your heart to stop or your respiratory, your lungs to stop or your brain to stroke and that.
So I had a C-section yesterday. I've been complaining about some thigh or some calf pain. And you walk in to check on me and I am just, oh my God, my chest hurts. What are you gonna do for me? Ooh, that's a good
First I'm
question.
gonna hit the code button
I'm gonna go
right
gather
next to your
supplies.
bed. Well, I'm not gonna leave you, I don't think. I'm gonna put O2 on you. I'm not gonna leave you, I'm gonna hit that freaking button because that's scary.
Okay.
And you can't breathe.
So 2 liters nasal cannula?
10.
10
Mm, Not nasal cannula.
Or,
We don't give
no,
them by
the
nasal cannula.
mask, yeah.
If we give a mask, we're not giving 2 liters because we'll suffocate them. If we're giving 10 liters, we're gonna put them on a mask. So don't forget that. If your flow rate is too low and you put them on a mask, you're suffocating them actually. Just a little tidbit.
That's bad.
Yeah, but we don't really discuss it.
Yeah, we don't, I didn't.
So, risk for DVTs, crank their legs up, put pillows under their knees. No pillows under knees. Don't put pillows under the knees. Yes, elevate their legs, but do not put pillows under their knees. We talked a little bit about postpartum depression,
Different than the baby blues.
different than the baby blues. Tell me more about that, and in what way?
The postpartum depression lasts longer than 2 weeks.
Okay.
And it will like really start to affect your life, and you like won't be able to care for yourself or the baby or anyone else really.
So what should I do about that?
You should probably talk to your doctor about that, talk to your family about that, so they can also help you out, or your friends or whoever's helping you. They might put you on some medication, probably recommend some therapy.
That's not very common, is it?
It's pretty darn common.
Like some of it's repeating itself, I'm gonna have to go through here and clean up.
No, that's okay.
Well, what if you get the same answer, like the same question twice, but you don't know the answer? Now you've missed it twice. Matt, would you please go through there and clean that up? I sure will. Let's talk a little bit more about babies.
I love them.
I know.
Babies, can we prevent SIDS?
No.
Well,
We can reduce the risk. How can we reduce the risk of SIDS?
Baby sleeping on back with nothing else in its crib.
No co-sleeping.
A firm mattress. Don't let the baby get too hot.
What's too hot? How do I know?
The baby be sweating maybe.
Well, they don't sweat, but that's a good guess. Well, how warm should I keep my baby?
Toast. You want to dress them in a layer more than you.
A light layer more than I am dressed. Yep.
Don't smoke.
Smoking is a big issue. So
Don't shake your baby.
don't shake. What do you mean shake my baby like that?
Sometimes you just get really, moms get really angry and they like unintentionally will be like,
is it the moms or the dads? It seems like every
it's
time I hear
both.
about it.
I've heard a lot about moms.
Really?
Yeah. Especially doped up moms. One of them put their baby in the washer.
What? No.
Yeah. It was bad. She thought it was the laundry.
Oh, maybe it smelled bad.
She thought it was the laundry? Oh, the baby was the laundry. I was like,
It was bad.
Where were we? Oh, SIDS. So for warmth, a light layer more than I am in. What is the best food for my baby?
Breast milk.
Breast milk is the best for my baby?
Colostrum. Technically.
Oh, well, in the beginning, colostrum, but I can't live on colostrum, so breast milk is appropriate.
Well, breast milk contains, your antibodies and stuff, so that's really good. Formula is, how do I say, very acceptable. It's a good supplement for breastfeeding if you don't want to breastfeed.
Or if you
Your
can't.
baby will still get, or if you can't, so your baby will still get all of its nutrients and stuff, but breast milk does have a few more natural benefits to it.
Fresh from breast is best. Okay? How do I, if I have pumped some breast milk and I've stored it in the fridge, how do I warm it up?
In a cup of hot water.
and
Like put the bottle
submerge
in
the bottle, yeah.
or the breast milk baggie or whatever.
So what, can I just nuke it?
That
kills
is
the
way
antibodies.
too hot for your baby.
It does, it breaks down some of the good value of it, plus you're gonna have hot spots. If I just pumped, if I pumped 2 hours ago and I left it on my bedside table, can I give it to my baby?
Yes.
Oh,
Breast
yes.
milk I can.
Yes.
Because it's within,
24 hours if it hasn't been in the fridge. If it's stayed at room temperature, it can be out for 24 hours if it's been.
I thought it was 8 hours.
I thought it was 8 hours too, but there might be new research out there.
I thought it was 24. I could look in my notes.
Yeah, look it up. There could be new research out there.
Mm-hmm.
Once we've introduced the milk to the baby's mouth, well, okay, now we can't go so long.
Now only an hour.
Yeah. And formula, once you've opened it, 2 hours, you're done. Once you introduce it to the baby, an hour. Okay. What more can you tell me about taking care of this little one? How do I, if my baby's like coughing up stuff, how do I suction the stuff out? What do I do?
Bulb syringe.
Mouth
syringe.
first.
Mouth first? So I put it in there and go,
No, squeeze it and do it in like this sides.
yeah, most on the sides. If they're kind of choking a little bit, that can be helpful because it makes them make a decision and usually gets them to cough it out because we kind of keep their gag reflex. Okay. Teach me about jaundice. The
It's the buildup of bilirubin. It can be treated.
Is that my brother, Billy Rubin?
Oh my god, you scared me.
My maiden name was Rubin.
No, it is not your brother building up in your baby. There's something from the liver.
Has something to do with the liver.
It's not from the liver? Oh, it's from the pancreas.
Pancreas.
What?
Where does it come from?
It's the liver.
I thought it was the liver.
The liver is immature and can't conjugate the dead red blood cells. So the liver is not producing it. It's just not, like us, our liver is taking care of it. Their livers are immature.
So their livers just aren't doing the thing.
So within like the first 24 hours, you're gonna get that baby under a light.
Yes, if my baby has jaundice within 24 hours. that's
Now,
not
after
normal.
24
There's nothing
hours,
named for it, but it's
after
more-
24 hours,
Biliary?
it's, or like, is it a couple days or something? It's like fine.
No, well, it's 24 hours. If it's the first 24 hours, it's more serious because it probably came from the mom, so it's something's probably going on in utero.
It's something pathologic is going on,
That's sort of,
and it's very scary.
yeah. And then afterwards, it's still serious, but not like.
They get to wear little glasses. They're just so cute. They just look like they're sun tanning.
Yeah, those lights are gonna help break that up.
And you need to keep them under the light unless if they're breastfeeding.
Yep.
You're done, put them under the light.
What if we don't? Why do we worry about it?
Because too much bilirubin can go in the brain and cause.
Oh wait, it's either seizures or blindness.
I don't think it's blindness.
Okay.
Seizures, yeah.
There's a word for it.
Corn. The cornectus.
Cornictus.
Cornectus.
Cornictorous.
Corn is icky to us.
Yep, cornictorous. Alright, what can cause the blindness? What were you thinking of that can cause blindness in babies?
Is it like an
Oh,
STD?
the STI. That's why you put the erythromycin.
Where do you check the baby for the bilirubin?
The
It depends on what
we
device
talk
you're
about the
using.
tip of the nose.
Yeah.
That's like the big one.
The big one is the
Or
nose?
it's like forehead, tip of the nose, or like right here.
If we think when we do that it looks kind of yellowish, we'll usually do a transcutaneous, which is just a little thing they put on there. And if that says, yeah, we're probably jaundice, then we do a blood draw to actually get the level. Okay? Why can't I just say the baby looks yellow, let's put it under the lights? That's what you were thinking of. Under the lights, that's why they have to wear the goggles, because the
Because
lights.
it can go blind.
That's where you got that.
I don't know.
We're telling you. Where was I going with that? What did I ask you before I got sidetracked?
Why can't you just say the baby looks yellow?
And put it under the lights.
Because babies have different skin tones and they just come in all different shapes, sizes, and colors.
Tell me about, what else do I want you to tell me about? Heat loss. There's 4 different types of heat loss. So know about those. And know what you're gonna teach the parents about those.
Convection, evaporation.
Yes.
I just made that up.
Alright.
Wait, what's the last one? Radiation.
You put a little hat on them.
So, and what you're gonna teach the parents about that. Why don't I want my baby to get cold?
Okay, do you want to be cold?
They'll burn up all their glucose.
They're gonna go through a lot of energy.
Why don't I want my baby to be cold? If somebody said that to me, I'd be like, okay, go outside with your clothes off. See if you like it. Just kidding, that'd be a lot nicer than that. Can you please go outside with your clothes off?
Tell me about baby care right after a C-section. How those babies look compared to vaginal.
Heads rounded.
Well, maybe if they were breech. But we do a lot of C-sections where they weren't breech.
Oh, okay.
What else?
Well, they don't get their lungs squeezed out.
Okay. So when we listen to them, they might sound a little moist for up to 24 hours, a little moist, as long as they're nice and pink. We don't panic. Okay. Anything else?
Do they look different or just any difference?
biggie is the lungs.
Yeah.
That's the biggie. Some of y'all were talking about bonding and the athlete did the bonding.
Skin to skin.
Mhm. And why don't we do skin to skin in the OR?
Cause they're stupid.
Something like that. You guys have been in the OR.
There's a lot going on.
It's cold,
Yeah, but the mom can regulate the baby.
but it's cold. She's laying there all strapped out like this. She got this much space.
But if you put the baby right there and they hold it, they said they can
Who holds
thermoregulate. The dad. Or the
Dad
supposed
could
to.
hold it.
Like he can make sure that baby
That makes me so nervous.
doesn't roll off.
That makes me nervous.
That's
But that's why we don't do it, is because the ORs are cold. And we have other things we need to do besides stand there and make sure the baby's safe. It just is how it is. It's just life. Okay? Tell me about circumcision.
it looks horrible.
Afterwards.
Complete afterwards. What'd you say?
It looks horrible.
Tell me more about it.
What'd you say?
Like when they rip the skin off.
You have to put Vaseline on the gauze pad and keep it over it.
Some of the service.
Oh.
Not the Plastabel.
No, because that'll slide it off.
Yep.
The biggest thing is to check it every
15 minutes or something, right?
And it looks like don't wash it for 2 weeks.
Yeah, just squirt some water over it. Don't scrub it.
They can't leave until they have it. Till they go to the bathroom.
Till you urinate.
Urinate.
Big risk of
Infection.
infection. And yeah, they can bleed too much from the circumcision. They can. We talked about initiating respirations, mostly yesterday. Talked about hypothermia. Tell me about some of the problems of the preterm baby.
They can't thermoregulate very well.
Regulate what?
Thermoregulate.
Thermoregulate. They can't thermoregulate.
Their lungs aren't mature. A lot of times they need surfactant.
Okay, what's surfactant?
It helps keep the alveolus open so the babies can breathe.
And we can give that right to the ET tube or whatever, yeah. Okay, so can't thermoregulate.
Depending on how preterm they are, you might need to cover the little eyesies.
Okay.
Because their eyes aren't ready for all the light yet.
So we don't want these preterm babies to be overstimulated by light, by sound, by touch. They're in a dark isolette where they've got white noise instead of the sounds, because that burns energy. Those kids cannot burn energy because they can't eat real well yet. They have no fat reserve. They have no brown fat. So we don't want them stimulated. If you're stimulating a preterm baby, you might see it in their vitals. You know, they might desat. They can't handle stimulation. So yeah, dark, quiet, no touching.
Skin to skin is still really good though.
Skin to skin is good.
Like mom.
But tell mom not to rub. Just hold. No rubbing.
Their skin is thinner.
Mm-hmm.
It's like sometimes like almost see-through.
So we gotta be very careful about skin tears. Their head is very pliable, so don't have that kid in one position all the time. Have you ever heard of NICU head, toaster head? Where they're laying on this side or this side. And they end up getting this head that's kind of shaped like this. As an adult, they kind of, so I can sometimes look at somebody and tell they were in
So if you have like a square head.
yeah, kind of a swell, but they don't get much time back here or here. So that's why you see in the NICU, you see them like this over a blanket. Don't lay them on like this, because now not only are you affecting their head, but their joints. So these are the kids that look like a W and a V, okay? Their hips and their shoulders are all split out. I digress.
That's awesome. I have a friend who has a square head. We call him Brick. I should ask you. Oh yeah, I could tell.
Why do we give vitamin K to the baby?
How Claudine brain bleeds.
They don't produce it on their own enough.
They don't produce it because their GI tract is sterile
Right.
until their first feeding, so you need to give the vitamin K because they were just squeezed through a little hole and their capillaries or vessels are very thin.
Yep. what is it they're putting in the eye? What is that antibiotic?
Erythromycin.
Erythromycin, good. What's the other thing we all can give just cause?
Hep B,
Hep B.
just for fun.
Just cause you're there.
Refresh your memory on the APGARs and at what score we do different interventions.
Under
Okay.
7.
And how often do we do the APGAR?
1 in 5
1 in
minutes.
5.
Unless it's
Unless
under
it's
7
Under 7 minutes every 5 minutes, like
until
15 minutes.
every 5.
Mm-hmm.
Usually we don't do it much longer than 20 minutes. Then either the baby has improved or not. Okay. EGA. Remember the EGA? Estimated gestational age.
Mm.
And the Ballard. Refresh your memory on, not that you would have to write out every part of the Ballard, but refresh your memory on what it is and why we do it. So the Ballard just gave us the EGA, so if I am at this day and age, everyone gets an ultrasound. I know exactly baby's due date. Why do we still do an EGA?
To see if they develop as they should.
Might pick up on some developmental issues, some physical developmental issues.
Or like if someone
Didn't get
didn't get, yeah.
prenatal care.
Mm-hmm.
Yeah, if my baby didn't develop like it should, or it's younger than we think it is, that's gonna affect a lot of things that we do with it. I was in on the woman that came from another country, had never had an ultrasound and delivered anencephaly. So, but we still every now and then see that.
I knew a lady that did that.
Yeah, you knew somebody?
Yeah, they would like never went to the doctor for anything. She didn't have insurance, didn't believe in insurance, and then when she ended up having complications, and her family made her go to the doctor, and the baby was missing a lot of its head.
All right, I already told you to refresh your memory. Kind of running low on time. I already told you to refresh your memory on the DIC and the health. Diabetes, tell me about gestational diabetes.
You get it when you're pregnant and it goes away when you deliver.
What if it didn't go away?
Well, then you just got diabetes.
A little more to it than that. So if I'm pregnant and I get diagnosed with diabetes, gestational diabetes, after the baby is born, a week later, my numbers still show I have diabetes. What's the likelihood that I was diabetic before pregnancy and didn't know? So if the gestational diabetes continues after delivery, we were probably diabetic and didn't know.
Just diabetic.
So tell me about the requirements, the diabetic requirements for like their insulin usage throughout the pregnancy. Yeah, nothing? Their needs for insulin change throughout the pregnancy, okay, as the size of the baby grows, as the hormones change. We have to watch diabetic pregnant women very closely because of the needs of the insulin as they change throughout the pregnancy. Why are babies of diabetic mothers, what are some of the risks for them?
They get really big.
Why do they get really big?
They're big.
Yeah. They're like,
Unless mom's really well controlled, yeah, they're big. But there's a difference between a big baby from diabetes and just a big baby, and they look different. The just big babies, you know, they can still like do all that stuff. Your diabetic big baby, I mean, they can't, they're just like balloons on their hands. They're very puffy.
why?
Because insulin is a growth hormone, has a lot to do with it. Plus, you think about diabetes, they do get puffy, and so the baby's getting some of that too. But insulin is a growth hormone. So if we're cranking out lots of insulin, because who's cranking out the insulin? The baby. Remember, that's why their blood sugar drops when they're born? You guys are all looking at me like you have never heard any of this. We must have had our minds on. Okay, so your diabetic babies, they're big. unless they're very well controlled diabetes in their moms. Puffy, they have problems with respiratory distress. That's one of the big risk factors for diabetes in parents and moms. We watch their blood sugars very closely after delivery because mom's been maybe having this high blood sugar, high blood sugar, high blood sugar. Well, the baby's pancreas is working and it's pumping out the insulin. It might actually be helping mom a little bit as it's pumping out too much insulin. But what happens when I cut that cord? Yeah, all that blood sugar is cut off. But the pancreas is still cranking out because they don't know. So we got about 24 hours where that pancreas has to settle down. Okay, so that's part of the reason that we watch their blood sugar so closely. Once the blood sugar starts to spiral, again, like the temperature, it just all spirals. Okay, so respiratory distress, hypoglycemia,
Baby, the mom.
baby. Where was I gonna go next with that? We were talking about diabetes. Mom is gonna have to watch herself closely, take different amounts of insulin at different stages of the pregnancy. A lot of students, like on their DCTs, would put that they're checking baby's blood sugars because baby is diabetic. Baby is not diabetic, all right? I just wanna make sure everyone's clear on that. No, the baby is not diabetic. We might call it a diabetic baby, what we mean is mom's diabetic, okay? Baby is pancreas is overactive. Well, let's see, what else was there? Complications of the baby.
Is this how many questions? 60?
Well, 50, 49 or 50. I think there's one that's worth 3.
Sway!
100 points.
No.
It's actually a good thing.
Review your ethics, your justice and benevolence, and review those from
Oh,
way back in
God.
2020.
Like how, as a nurse, like if you don't support abortion, like you're not gonna tell the patient that, but you're not gonna be like a part of that like procedure, or like.
It might be kind of like that. It might be, what are some things we see in OB that are ethical dilemmas? Debbie comes in, has never had a support person, has never had a job, and she's delivering baby number 9. Sue comes in, quite wealthy, married to a very successful lawyer, did work, but has recently quit because she's having her first baby. What would we call it that we would give them both the same excellent care?
Justice.
That kind of thing.
Equality.
So review that kind of stuff, okay? Because we should give them both the same care, okay?
I guess.
Good guess.
Was it a good guess? Like a real good guess?
Well, I mean, I don't know, I don't have the book in front of me, but in my mind, it was justice. Medications. Tell me a little bit about magnesium sulfate.
Even for high blood pressure, but it's actually because the seizures that can happen with high
Okay.
blood pressure. It is like relaxant, so you normally are on a higher dose of PIT to like help with the contractions.
If you're on PIT at all. Maybe we don't want you to have contractions, okay? As a nurse, what are your concerns with magnesium? Mom's started on magnesium, what do you need to think about?
Hypermagnesium.
What is hypermagnesemia?
Magnesium toxicity or something?
Yeah, what's that gonna look like? I'm monitoring my patient closely for specific things. Oh, that's a good question. Well, what did you say magnesium does? Why might we be giving more dosing?
It's a relaxant.
Okay?
So
Relaxes
like they
what?
become like too relaxed, like their respiratory rate
Respiratory
decreases.
rate. You're monitoring that respiratory rate, okay? Now here's the flip side of it. You've been given mom mag. You've got her magged out, and the baby delivers. And I'm the NICU nurse. Now what do I have?
A baby with a low respiratory rate.
Yep. So now the NICU nurse has a baby that doesn't want to breathe, but magnesium is very irritating. It upsets your GI system. There's just a lot of things about it that just are uncomfortable for the person receiving magnesium. So I have a baby that's extremely crabby. Now usually the baby screams at me all night long, and it's exhausting, but if it stops screaming,
Then you're concerned.
if you stop breathing, yep, okay. What can we give mom if she's got too much mag? What do we give her?
Calcium, gluconate.
Gluconate, calcium gluconate. We just let the baby blow it off, literally blow it off. Okay, we don't give the baby anything. Okay, tell me about Stadol and Nubane. They're kind of a same type of drug. Stadol, S-T-A-D-O-L, and Nubane, N-U-B-A-I-N. Talked about it yesterday. We did.
Well, I believe you.
What do you,
remember.
what do you guys remember, anybody? About
Wait, say it
Stadol?
again.
Stadol and Nubane,
Stadol is for pain, it can cause respiratory distress.
okay? Stadol is for pain, may cause respiratory distress. Nubane,
That's for severe pain.
okay?
Just got drowsiness and nausea and vomiting. It's a narcotic though, so that should cause respiratory distress too.
So I got a mom in labor, and I've just given her Stadol or Nubane, and out pops the baby. What do you think about that baby?
Low respiratory rate.
The NICU nurse has to worry about that kid being sedated.
About what?
That baby is sedated.
Sedated.
When do we give, yeah, obviously during labor, but at what point, I'm ready to give Nubane, IV. When precisely do I give it? I'm watching Mom.
During a contraction.
During a contraction. Okay. Good. Let's see, what else? Pitocin, you know about Pitocin, right? Sometimes we give Pitocin and we cause tachysystole, which is
The uterus contracting too much?
too fast,
Too fast.
because the baby can't recover. As the nurse, usually the order is written for you to titrate the Pitocin. Pitocin is one of those scary drugs, okay? So there are a lot of really scary drugs in OB. Magnesium, Pitocin, the new, just lots of scary ones. Demerol. What other medications are gonna be on there? What is that medication that we give to reduce opioids effects?
Narcan. Naloxone.
Naloxone. So I might, if my baby's really sedated from Nubane, I might give some naloxone. But there's certain babies I am never gonna give that to. And that's if mom was addicted. Because if mom was addicted and I push naloxone on either mom or baby,
It'll put you right into withdrawal.
right into withdrawal. So you gotta be careful with that. Refresh your memory on amniocentesis. We talked about that a little bit yesterday. So while we're talking about magnesium, we talked about blood pressures. So what are those called when we're worried about the blood pressures being high in pregnancy? There's a term.
Hypertension. Preeclampsia.
Preeclampsia, moving into eclampsia. Okay. So that's a lot of this. Moms can be on labetalol during pregnancy. So I get a phone call on First Nurse. I am 34 weeks pregnant. My call. 34 weeks pregnant, and Yeah, they've been watching my blood pressures. No, we're not really doing them yet, but they've been watching them kind of closely. But man, the last 2 days, my head is just exploding. You worried about that? Oh yeah. Terrible headache all of a sudden. Swelling in the hands or face. Epigastric pain. All right, we are very concerned about those things related to blood pressures and pregnancy.